Welcome to MedEd Bytes, micro just-in-time education. Today's MedEd Byte will discuss setting endotracheal tube length and managing cut tubes. As a review, the SonarMed system will assume the length of the endotracheal tube in use is standard in length. Some endotracheal tubes are not standard in length or have been cut by the clinician. If the tube length is not set right, you will receive incorrect measurements, but not to worry, as we will cover what to do in those situations. How do I know if the endotracheal tube length is set correctly? Once the calibration phase of the setup is complete, the next step, after connecting the sensor to the patient's endotracheal tube, is to press the button to the right of the green Go icon. This will display a text box reminder to adjust for a cut tube. It is good practice at this point to ensure the tube length is accurate. Press the function button to the right of the green checkmark to accept the length correction reminder. Then go to the waveform screen. Press the button to the right of the waveform icon. There are two things you want to check at this point. One, is the FiO2 setting matching the setting on the ventilator? If it is not, it will need to be adjusted or you may receive nuisance alarms. 2. Is the left echo between the two vertical red lines in the middle diameter box? If the green circle is at the base of the echo and within the red diameter box, your ETT length is set correctly. After both steps have been completed and the settings are correct, you can return to the main screen and set baseline. Next up, how do we adjust the tube length if it's not correct? Example, your ETT may have been cut on a previous shift and wasn't adjusted on the monitor. In most of these instances, you will find there is no green circle visible on the waveform screen in the diameter box. In the picture, you'll see the tube has been cut by a few centimeters and needs to be adjusted. Notice how the left echo is to the left of the red diameter box. By pressing the right or left directional buttons on the keypad, highlight the tube length display, and then quickly press the center button on the directional keypad to display the highlighted tube length. Using the up and down directional keys, adjust the tube length until the left echo is between the two red lines within the diameter box, and the green circle will appear. You should stop once you feel the echo is centered in the red box and the green circle appears. Once satisfied with the length setting, press the return key. In this next photo, it's showing a tube cut short and not adjusted to the proper length. You can tell because the left echo is to the left of the red diameter box. Once the echo is adjusted correctly, the alarm will stop. After adjusting your ETT length, your waveform should look more like this. Remember to check your tube length as a part of your shift change checklist. Medtronic, engineering the extraordinary.